Okay, and I'm back. Now I'm inside of the music lessons place, and I have found what I think is a quiet room. So I'll see if I can get a little bit more of our conversation through here. So what I was just about to get into is the development of the welfare state. And so what we see as the origins of this is if we go back to the Great Depression, 1929, we have the stock market crash. The president that's elected after that would be Franklin Delano Roosevelt. And when Franklin comes in, he undertakes these different measures to try to stem the depression and creates all of these social programs like the CCC and the AA and these different programs that try to give people work. What he also creates is Social Security. And so he has some long reaching um, programs that expand the influence or the presence of the federal government. In the 1960s, we have Lyndon B. Johnson, who implements his Great Society. And with his Great Society, we have these programs that are designed to readdress social, political, and economic inequality in the United States. One of those programs initiates his war on poverty. And so, with the Economic Opportunity Act of 1964, um, people were encouraged, or programs were created to educate and train people for employment. And so this tries to, it's kind of like a war on not only poverty but also unemployment. 20 years later, 1985, we have Ronald Reagan's second term as president. The election in 84 allows him to focus, his reelection in 84 allows him to focus specifically on how the programs that were started 20 years prior had been going. And so he re examines social welfare policy. There's also the war on drugs that begins during this time period. And so the Just Say No logo that you are familiar with, that comes into play during the 80s because of that. We've got Clinton coming in after George H.W. Bush, after Reagan. And when Clinton comes in, he kind of charts this middle course. Lots of different important reforms were implemented during his presidency that I'll mention a few later in our time together. Then you have George W. Bush who comes in, and when George W. Bush is in, we have this massive expansion of welfare benefits. Then with the current President Obama, we have him enacting the biggest welfare change reform since the Great Depression or the New Deal workings of FDR, and that's with the passage of the Healthcare Reform Act of 2010. Okay, what social insurance does, this is kind of like the umbrella term for Medicaid, Medicare, Social Security, is it protects individuals from different types of loss. You might call this an entitlement. And so the origins of Social Security, right after World War One, up until the Great Depression, in Europe, these social insurance programs began to pop up. In the United States, they were left to private agencies. People just kind of took care of it themselves. There wasn't a federal government program that would take care of this. But with the Social Security Act of 1935, we have the Social Security Administration that oversees this program that is enacted to take care of people. It's a pay-as-you-go system, and so I am paying Social Security for people who are currently benefiting from Social Security in the hopes that when I am at an age that I would benefit from Social Security, the program will still be around and people will be paying into that program. If that doesn't make sense, we'll talk about that in class. But what the Social Security Act of 1935 does is it takes care of or provides three different things: social insurance, and this would be for people who have maybe lost a spouse. This would be people who are older in age, and this would be people who are unemployed. You also have financial assistance. This would be for people who are needy, maybe they're blind or disabled. And then finally, you have health and welfare services. This could be for children. This could be for orphans. This could be for people who are in need of vocational rehabilitation because they're disabled and they need to learn new skills. Um, kind of an idea of how Social Security has been collecting or has been paying out since 1955. In 1955, it took 9 workers for every one beneficiary. Today, it takes 3 workers for every beneficiary. And throughout time, you'll see that in the United States, birth rate, mortality rate, and economic effects, the economy, I should say, uh, affects the program of how many people benefit. Um, as I was saying just a few minutes ago, that there's been lots of questions about how long this Social Security will last, and so there's been a lot of movements to reform it. And that was one of the things that George W. Bush wanted to do, was privatize Social Security. Did not happen, and it's something that President Obama has tried to protect against. He does oppose privatization of Social Security, but he has been open to some different types of reform. They've kind of taken the back burner, though, because of the recession and other problems with the economy. In regard to public assistance, until 1996, the government imposed national standards on state programs and distributed the funds based on the proportion of people in that state who were classified as being impoverished. And remember that link that I gave you, you can see the poverty line. You definitely should have done that by this point. It's on my wiki in case you don't remember going to that or you haven't been yet. Poverty level is the minimum cash income that will provide for a family's basic needs. And so this is in reference to the number of people in the family. It's a moving scale. The poverty threshold is what the Census Bureau uses to determine the number of people who live in a house is above or below the poverty line. I'm just about to have to go to my daughter's piano class, so I'm going to have to leave you again, but I shall return.